Welcome to our latest Hippocratic Adventures chat, where we talk about everything related to practicing medicine abroad. I'm your host, Dr. Ashwini Bapat. And if you haven't already, make sure to join our weekly newsletter. This is where we share inspiring stories, job opportunities, and strategies to help you move abroad. You can sign up at hippocraticadventures.com/subscribe. Today, I'm here with Dr. Leena Rahmat. Dr. Rahmat is a hematologist oncologist with a background in BMT, focusing on heme malignancies. She trained in Ireland and the US and has worked in Peru. She enjoys equestrianism and traveling. So before we get started, make sure to smash that subscribe button, sit back, and enjoy. Leena, tell me your story. How did you end up in Ireland? Let's talk about that first. I think there's a lot of a story there, and then we'll get to Peru later.
All right, sure, Ashwini. Thank you again for having me on your show. So how did I end up in Ireland? It actually stemmed from a push from my grandparents. It's not some major earth-shattering story. I knew from an early age sort of which direction I wanted to pursue from a life and occupation perspective. And Ireland, lots of other European countries and Asian countries offer the medical degree without having to do an undergraduate degree. So my grandparents were like, hey, we know, we had these really smart Irish students in our class when they were like, this was back in the 40s or 50s in India, because they migrated from India to Pakistan. But anyway, they had some connections with Irish friends. And they said, we hear the education system is fantastic there. Check it out. I'm like, sure, it doesn't hurt. So I'm like, why do an undergrad degree? And when I know I kind of want to do medical school. So there's a little bit of an unexpected twist. Before I started medical school, I actually started an undergrad degree at McGill in Montreal, but I was only there for a few months. While I was there, I'm going to come back to that with you.
We're going to come back to that. I went to McGill as well. So this is amazing.
That's a really fun coincidence. So what happened was I was starting my summer at McGill. I received an acceptance by my medical school. It's called RCSI, the Royal College of Surgeons in Ireland, and they start their semester like a couple of months later than the North American schools. So I had to make a major decision at that point about whether I want to continue undergrad at McGill and then apply to med school. But if I knew more information about med school than I did about undergrad. So I was like, that's my answer. So I packed up my stuff, said goodbye to my new friends at McGill, and moved to Ireland to start a year pre-med and then the 5 years of med school. So that's how I ended up in Ireland, mainly driven my decision to pursue medicine.
Amazing. So it sounds like the medical school in Ireland is a 6-year program.
It's 5 years medical school and 1 year of pre-med. So it kind of depending on where you're applying from and your whatever equivalents you've received in high school, you get offered either a 5-year program or the 6-year. So correct, 5 or 6 years. Yep.
Okay. And what was your experience like there? I know you were in medical school there, and then you actually went on and worked there later. Can you tell us about that as well?
Sure. I wanted to keep my options open as somebody who had lived in Ireland at that point for 6 years, and I didn't have a permanent geographical home in the back of my mind. I wanted to keep options open. So I wanted to do an intern year, which allowed me to register with the Irish Medical Council to keep my long-term options open. And my intern year there consisted of 6 months of medicine and 6 months of surgery. That's just how the internship is set up there in general. And then I did an additional 6 months of specifically surgical oncology partial residency, or it's called SHO, or senior house officer. And the major difference there between Ireland and the US is that I spend 80% of my time with patients in Ireland and 20% with a computer. And in the US, it's the opposite. I think I spend 20% of time with patients and 80% of time with a computer. So that was one major difference. The clinical practice, I mean, we're much more hands-on. We get our hands dirty in Ireland as interns. I was putting in peripheral IV lines, drawing ABGs daily, drawing labs, doing paracentesis when I was on the oncology unit. Um, so it was a lot. The scope of practice was quite different from what you do as an intern in the US. Um, I don't think one is necessarily better than the other, but I think some of us who go into medicine to practice medicine, I kind of enjoyed the hands-on experience. I'm not here to treat a computer. So that was a major difference in terms of clinical practice. Work-life balance, it's great in Ireland. I mean, nightlife, social life, it's very it's very jolly. People are happy-go-lucky. People go out several times during the week if your schedule allows. It's less regimented, I think. And I think that's just a reflection of, in general, Europe tends to be less busy from a work sense at times, which allows people the freedom to kind of enjoy a more balanced work-life balance compared to the US. Um, Again, not necessarily a better thing. It probably depends on what works for each person.
And then, can you also, actually, since we're on this topic, can you also break down what that training hierarchy looks like? Because we hear a lot about interns, and then you mentioned senior house officer, and then maybe you can tell us what's beyond that as well and how that works. Because I think that's actually a huge difference that I think is shocking for a lot of US trained physicians.
Sure. The major difference in training models is that in Ireland, the training is less streamlined. And in the US, it's more streamlined, meaning in the US, you apply to residency programs and they're guaranteed whatever between 2 to whatever number 5, 6 years of residency with a guaranteed attending spot at the end. Or you can go on to pursue fellowships, but it's still a guaranteed spot as an attending. In Ireland, you have to almost apply every 1 or couple of years to advance in your training. So in medical school, I applied for an intern position at the hospital I wanted in Dublin. And that's how I did my internship. And during my intern year, I had to apply again to advance to like the PGY2 or 3 equivalent in Ireland. It's called senior house officer. And so then I happened to apply to what was like an opening, a 6-month spot. And that's how I did my 6 months of senior house officer there. But had I wanted to continue training in Ireland and try to advance, I would have had to apply almost every year to advance to like a fellow equivalent in Ireland that's considered registrar. And then above that is a specialist registrar. And then once you become like a registrar in Ireland, which is, let's say, a fellow equivalent in the US, you're not guaranteed a spot as an attending to work. You just stay as a registrar or trainee, and you could remain at that level of training for your entire life, which is not ideal. I knew a lot of registrars who were in their 40s and 50s, and they wouldn't be able to get an attending spot, or the equivalent in Ireland is called consultant spot, unless a senior consultant or attending in Ireland either moved out of the country or something worse, they passed away. So there was a bottleneck effect in training in Ireland, which really, for folks who have a clear goal in mind of becoming a specific type of consultant, it's not ideal to remain at a level of trainee. And that's in regards to practice, pay,
Mhm.
and career growth.
And so when you talk about a registrar, though, like you wanted to go into hemonc, so then would you be a registrar within hemonc and potentially just stay a registrar for 15, 20 years, even though you have 15, 20 years of experience under your belt, let's say?
Exactly. So had I stayed on, and you already mentioned I had pivoted from surgical oncology. So after my 6 months of surgical oncology, had I stayed on there and switched to hematology, or oncology, I would have had to apply almost every year, to try to advance to get a consultant or attending spot in Ireland. And I could remain a registrar or specialist registrar for years, potentially decades before I had an opportunity. And I think for me, that was one of the several reasons I eventually had to make a change again.
Yeah.
So yes, that's a major difference in training, is that you just remain a fellow. It's like remaining a fellow PGY 6 or 7 fellow in the US for decades without becoming an attending.
But then as in that registrar role, do you still would you still have independence to carry out your patient plan and your assessment and things like that? Or do you have to then pass it by the consultant to make sure they approve of it, even if, let's say, you had worked in hemonc for 10 years?
Yeah, that's a great question. I think it kind of varied depending on the consultant team that you were with, but the majority of the time, the registrars and specialist registrars were very independent, and functionally, you could kind of say they are functioning as attendings, or consultants. If they had questions, and they definitely, had to run it by the consultant. Um, but they still had to kind of run a lot of cases by the consultant because, I mean, medical legally, you're still on paper a trainee as a registrar.
Oh, okay.
Yeah.
Wow. So you can just be a trainee for 10, 15, 20 years then.
Yeah, and that's a reason a lot of us, left, or a lot of my colleagues
Yeah.
left, and a lot of them have returned now. Especially like my Irish friends. They had good reasons to come back home, and I do hear that the Irish system is trying to change that bottleneck effect. I haven't been back in over 10 years, so I don't know how much of that change is implemented. So yes, it was it was a little challenging at times.
And then to then be promoted kind of up the rank from registrar to specialist registrar to hopefully at some point a consultant, is that based on like how much research you do, how many papers you have, or is that what is that based on?
Yeah, it's based on a few factors. One is publications, so amount of research work you've done, letters of recommendation from the various, consultants you may have worked with, and of course, medical school transcripts are looked at. And then fourth thing is the MRCP, like basically the board exams, the equivalent of the USMLEs.
Okay.
Um, yeah.
And then how does the salary compare? Because this comes up all the time, whether it's Ireland or Canada or New Zealand. Um, you know, there isn't most of the countries I've looked at, physician salary compensation in the US is the highest in the world, easily. How does that compare for, let's say, a hemonc physician in the US compared to Ireland? Are you loving this conversation, but are you thinking, I don't have a job in hand, I can't move abroad? Then you've got to download our free cheat sheet, The 7 Physician Jobs You Can Do From Abroad. Download it now.
The salaries are definitely, let's say, half of what they are in the US, in Ireland. Um, a lot of consultants in Ireland will make additional money by working overtime. The one beauty of working in Ireland is that you do get paid a very decent overtime, for those who need to work overtime or have to. At least you are compensated for the work you're doing. Um, but in general, the compensation is a lot lower compared to the US. Um, and then having said that, even though you may, even if you make whatever you make in the US with all the overtime you do, everyone always brings up taxes, and the taxes are real, actually. Almost, 50% tax bracket is what you're looking at. Um, so yeah, to answer your question, comp in the US is much higher than in Ireland. Um, and that's just looking at comp. We're not talking about work-life balance, though.
So how would you, from your perspective, having worked in both the US and in Ireland, yes, if you look at compensation, Ireland is going to pay less. But how do you then think about work-life balance, and are there benefits that are offered with that 40% tax bracket in Ireland?
So my response is going to be quite partial and biased towards Ireland. Because so there are a lot of benefits. I mean, the universal healthcare system in Ireland is it's good. Not perfect. I don't know where there's a perfect healthcare system, but there are a lot of benefits with the taxes over there. You know, I'm not going to go into the political details, but I think to me, what I saw working there and what I see now from my friends, I think they are appreciating the benefits of the taxes that they pay because it's benefiting the people in Ireland. Secondly, I think from a work-life balance, I think it is better in Ireland, and having that peace of mind, which um, for the reduced comp, I think for a lot of people is it's really important and something that they prefer. And I think that also comes with in Ireland, there's less of a corporate medical push. In the US, I think, you know, I've noticed that there's been a huge shift from sort of what I call non-corporate medicine to majority of practices are very corporatized, and that shift has happened within a 10-year span, like a significant amount. I know we know it started a long time ago, but it's certainly more pronounced now. So in Ireland, if you're spending majority of your time dealing with patients and clinical issues rather than peer-to-peer reviews or arguing about denials from insurance or writing letters to insurance, I think the practice of medicine with a lower comp and better work-life balance is extremely appealing.
Mm-hmm.
And I can see why a lot of people would start shifting their focus. Like if you practice in the US, why Ireland or a place like Ireland would become a lot more appealing. It's just less stressful and less time spent on bureaucratic issues. And that's for people who maybe like me don't necessarily enjoy the bureaucratic stuff. I'm here to practice medicine, not administrative stuff.
Mm-hmm. Yeah, I mean, I think that speaks to something that you shared earlier, which was that in Ireland, you saw patients 80% of the time and sat in front of the computer 20% of the time. And that is, I mean, in my experience, that is definitely flipped. I remember even as a palliative care doctor, my interactions with patients were very brief compared to the amount of charting that I did, compared to the amount of phone calls I had kind of behind the scenes that was not in front of the patient, compared to the amount of coordination we were doing. And one of the most fulfilling parts for me was actually spending time at the bedside, connecting with someone else, being available to someone else who oftentimes was really scared because they were in the hospital. So I can definitely see how that aspect would be incredibly fulfilling and helps to kind of balance out, okay, the lower salary, because it's those interactions and it's those connections, which is what a lot of physicians went into medicine for. And it's those connections that are then gonna kind of help prevent you from burning out and help you actually enjoy the practice of medicine. So I can definitely see that. And for your friends so have you thought about actually heading back to Ireland, or have you, I think you had a recent move actually, from one state to another.
Yeah, you know, it's a good question. And so I've had to move a lot, as has everybody in the field for, you know, residency, fellowship, etc. Jobs. I mean, I moved a few years ago from the West Coast, from my second fellowship to start my first job on the East Coast. And then I moved again like about a couple of years ago, and I moved a third time, and that has nothing to do with job. It's more to be close to family. So I'm now outside of Massachusetts. But to answer your question, so yes, it's in the back of my mind as somebody who was born and grew up and initially trained in medicine outside of the US. I think that thought of, do I want to do I want to move back to Ireland or somewhere else to work? I think it's in the back of my mind. It's not something I think I have the energy to practically do right now, just because of my constant moving over the past few years. It can get tiring,
Yeah.
physically tiring. Um, but yes, I have certainly thought about it, but it's not like a serious practical thought that's turning into action right now. Don't know what the future brings though. I'm always somebody who likes to keep options open. Um,
And you've maintained your Irish medical license then?
yes, I think it's not something that we've had to like renew annually. It's like it was like a one-time registration.
Oh,
So
okay.
it's not like I like rescinded
Right.
that. So
Okay.
to the best of my knowledge, it should still be active, but I haven't even checked on that in the last like 10 years. It may not even be active now that I think about it.
So
Um,
actually, that brings me to kind of your experience in Peru, because even while living in the US, you continue to kind of um, enjoy or look into global health experiences. I think probably because you had so much time outside the US. So talk to us about the work that you did in Peru, how you got involved in that, and what that was like as well.
sure. In between my second fellowship in San Francisco and starting my first attending job with Hopkins, I took some time for myself, and I volunteered with an organization called Health Volunteers Overseas, HBO. They're an organization that helps physicians and I believe other healthcare workers um, practice and volunteer in various locations across the world, including Cambodia, Vietnam, Peru, and probably some additional places that may have been added that I'm not aware of. And I had a window during this between my move from West Coast to East Coast. It was a 2 week window, and it happened to fit with this stint that the HVO had in Peru. So number one, I'd always wanted to kind of do some global work if the opportunity allowed. And secondly, I wanted to explore South America. I've never been there. You know, what better way to combine my like love of medicine and travel and see new places. So I ended up in South Peru, Arequipa, with this organization. They had me stationed at a specific hospital there, and I was there for about a month. And yes, I spent majority of my time at work because that was why I was there. But gosh, the hospitality of people there. I mean, have you been there? I don't need to tell you this if you've been there.
No, no,
Um,
we've only traveled there. We've only visited like Machu Picchu and Cusco, and I think we were actually in Arequipa because I remember they had a really good like gelato or something that they were famous for. But
Yeah, yeah. So, people are very hospitable. We'd go out almost every evening. The local docs would show me around their town of Arequipa, do some little evening trips. And they helped me organize a quick weekend getaway to Machu Picchu towards the end of my trip and the little things like that. There was a night out with their own fellows. So it was, I mean, from a work perspective, again, we spend majority of our time with patients, probably 90% with patients and 10% on a computer. That experience was very different though. I mean, Peru, unfortunately, socioeconomically, there's a lot of poverty, a lot of limited resources. So even though I did enjoy being there, it was also a huge learning experience for me. To see how they function without sort of the resources that we have in the U.S. And it is quite heartbreaking to see that, but it's also eye-opening. They appreciate you being there, volunteering your time. Um, one highlight of volunteering with the organization there was we were able to transfer a teenage boy with some high risk refractory acute lymphoblastic leukemia to St. Jude's in the US Research Hospital. Um, so it was just a thought that we had that this is our last resort, and it actually happened. The fellows helped me get him a passport, and then the travel documents he needed, and then St. Jude's kind of helped with travel plans. So I think to kind of see how they function with so little is heartbreaking, but gratifying for us. And I think it's a very unique experience and invaluable to work in places outside of the U.S. or outside of basically your home country or your home institute.
Yeah, I think that offers a lot of opportunity to grow. You're going to see different things. Things are done differently as well, and you have to adapt to that as well. So now I'm going to switch over to some rapid fire questions. So the first one may not be so rapid. Any advice you have for a fellow physician who's thinking about moving abroad, or let's say moving to Ireland? What would you say to them?
I would say if you're thinking about it, then you should consider it very seriously, because my philosophy in life is you don't want to end up thinking, what if I had done that? What would have happened? Whether the outcome is going to be negative for you or not even negative, maybe not what you expected or not, at least you've tried something that you've thought about. I think the experience of working in Ireland or countries outside of the US is unique, and I think you'd learn, or at least I would learn a lot by working elsewhere, moving elsewhere. That's the emotional side of, working in medicine. The practical side is always the finances. If you have the financial ability or planning to be able to take a pay cut and move elsewhere, I would encourage anyone to do that.
That's wonderful. That's great advice. Because I think you're right. If you're at the point where you're wondering, what could work, what could life be like in this particular country? What is medicine like in that particular country? How could I grow in that setting? Then it's definitely like a good idea to take a closer look at what the possibilities are for you. And my mother-in-law always says, those who search find. So if you are looking for opportunities, you are going to find opportunities.
That's great, actually. And I want to add to that, Ashwini. Um, I think that saying is really great. And it's also, I think if you are thinking about moving elsewhere and you don't make that decision based out of fear, I think fear-based decisions may not always lead to a happy outcome, because you're not really following maybe what you believe for yourself. I don't know if that makes sense, but I think just making a non-fear based decision leads to better outcomes in the long term.
Definitely, definitely, because sometimes fear can actually shroud your thinking. It can shroud your creativity of what's possible for you. And fear, I mean, it makes a person shrink up. You've seen that in patients. When patients are fearful, they shrink up. When people are fearful, they shrink up. They can't think very
Yeah,
clearly. So definitely any sort of decision, any sort of big decision, whether it's moving abroad or any sort of important decision, you don't want to make that out of fear.
you,
Absolutely.
you don't. And it's not a permanent decision, right? Any decision can be changed.
I think
So,
it's actually really important to highlight, and I don't think we've highlighted it enough. It doesn't have to be a permanent decision. You don't
yeah,
have to just like live abroad forever. It can be for a period of time where you try out, hey, maybe for 6 months, maybe for a year, or maybe for a 1 month stint, Do I like this? Let me dip my toes in it and see what it's like. Is this for me?
yeah,
Um, I think that's such a great way to test out the waters and see if it's going to be a good fit for you.
yeah.
And then the last rapid fire question is, what is the coolest place you visited, either in Ireland, where you spent 6+ years, or in Peru?
Gosh, I think the coolest place for me has to be a place you visited, Machu Picchu. I know it's very cliche, but there's a reason it's so popular. I mean, I think there's no words to describe how breathtaking Machu Picchu is and how refreshing and colorful of a region it is.
Yeah.
I mean, of course, I'm always going to be partial to Ireland and its beauty and beautiful music scene, and they have a lovely, bustling nightlife and all of that good stuff. But Machu Picchu has to be just absolutely breathtaking. Um, between the two.
Yeah.
How about you?
The coolest place I've,
Also, yeah.
there are so many. I'm just honestly, I'm thinking it's summer right now, so I'm thinking about this beautiful, like quiet beach it's about 2 hours south of where we live. And the water is turquoise. There aren't a ton of people there. It's kind of like this hidden beach. And it's just really peaceful. Like
Yeah,
it's beautiful, it's peaceful. It's a place where every time we've been, I just feel kind of inspired by how beautiful it is. So it isn't like a big place. It isn't like a museum or a big tourist attraction or anything like that. It's a really quiet beach, but I would love to be there.
that's awesome. And how beautiful that it's so accessible to you
Yeah,
guys.
yeah. So Dr. Leena Rahmat, thank you so much. Thank you so much for joining us. Thank you for sharing your experience and your advice and your words of wisdom that come from having experienced two different healthcare systems.
Well, thank you for having me, Ashwini. I appreciate the kind words as well and the invite.
You're welcome. Well, if you want to learn more, make sure to sign up for our free email newsletter. This is where we send out weekly inspiration, job opportunities, and strategies to help you move abroad. And of course, if you're watching this video, smash that subscribe button and also share this with your friends and colleagues. That's how we help reach physicians who are wanting to move abroad but just don't know how. And with that, we wrap up another episode of Discovering Where Your White Coat Can Take You.